Good morning or good afternoon, depending on what part of the world you're in. Welcome and thanks for joining us today. I'm Neil Halfin and I am at UCLA and I lead something called the Life Course Intervention Research Network that's funded by the Maternal Child Health Bureau. The LCIRN brings together researchers from around the US who are looking at when and how to intervene most effectively to improve life course health trajectories and well-being. Life course interventions, as we define them, are not just interventions that are directed towards individuals, but also interventions targeting families, targeting schools, targeting communities, things that potentially can change the whole ecosystem of human health development. We know that engaging stakeholders at all of these levels is key to life course intervention research and has the potential to shift the power to communities to develop more equitable and more effective interventions and to improve long-term outcomes and reduce health inequities. But there are also a lot of challenges and barriers to community stakeholder engagement, like funding restrictions and tight timelines, just to mention a couple. Even expectations around academic productivity and criteria for advancement can make it hard to take the time to meaningfully engage that are so crucial and important. We're very excited today to have a team from the Jordan Institute for Families at the University of North Carolina who are going to be leading this discussion today under the very able leadership of Sarah Verbeest, who's one of our core steering members of the Life Course Intervention Research Network. The Jordan Institute is catalyzing change by connecting the wisdom of communities and social work, research, policy, and practice to advance strategies to support families across the lifespan. With experience across the maternal child health spectrum, they will share case studies from their own work to illustrate different ways of engaging stakeholders and will help us think about why it's so important that we make the effort to do so even when it's not easy. A couple of quick logistic issues before I turn it over to Sarah, who will introduce her team and the rest of the webinar. All participants will be muted during the presentation. If you have questions, please type them into the QA box, question and answer box, or into the chat, and we'll do our best to respond. I'll be sort of monitoring those as we go along. And so when we get to the question and answer part of I'll be sort of curating the questions as we go. So, so with no further ado, let me turn it over to Sarah and her team.
Thank you, Neil, and thank you, Mary, for organizing this space for our webinar. And thank you all for taking the time to join us for this hour. So I'm really excited to have our team here today. We kind of offered a group introduction to Neil because we really are trying to model collaborative leadership, and we do a lot of collaborative work. And so I think as each person takes the clicker, I'll have you maybe just say your name and your official position at the university if you'd like. But overall, the Jordan Institute for Families is nested within the School of Social Work at UNC. And so we all have a connection to the School of Social Work, as well as to other schools such as the School of Medicine and Frank Porter Graham Center for Early Childhood Development. So with our time with you today, we have a lot of hopes of things we want to cover. So we will be moving pretty quickly through these. We wanted to start and really talk about how stakeholder engagement can both advance equity, but also how it can perpetuate inequity if it's not done well. We'll also talk a little bit about why engagement really matters. Then we're going to talk about 5 different approaches to community and stakeholder engaged work. And we're going to kind of go a little bit round robin and talk briefly about some of the different projects and some of the methods that we've used. And then we're going to close by offering some strategies for adapting these engagement methods to a virtual context. And this is a mission of the Jordan Institute for Families. We really wanting to center safe, stable, and nurturing families, focusing in North Carolina and beyond. And we want to be part of creating a place in families where everyone can be healthy and well and have a chance to really grow and flourish. So with that, I'm going to turn it over to Allison DeMarco.
Thanks so much, Sarah. And welcome everyone. I'm Allison DeMarco. I'm the equity lead for the Jordan Institute at the School of Social Work. And I'm also an advanced research scientist at the Frank Porter Graham Child Development Institute. With these 2 affiliations and just generally my research work, I've been doing a lot of research and thinking lately about how we can be more equitable and have anti-racist methods in our research methodology across the lifespan. So I'm gonna try not to go too fast, but I have plenty more information that I can share with folks if you want to know more about this. But I'm going to talk a little bit about centering equity through engagement. And so first, I just wanted to share some brilliant words from some of my colleagues. So first, Dr. Iyama Aruka says that the role of authentic research and engaged research is to help tell us why and how to effectively address the disparities that we are finding. And Derek Bell says, we're not simply called to include the voices of the most marginalized or traditionally excluded. We're required to take appropriate action to address the injustices exposed. Next slide, please, Todd. Next slide, please.
So the slides are progressing on my end. Are they not on yours?
I don't see the next slide.
Yeah, this has been a problem, and when I share slides, I don't know if Catherine or someone wants to try to engage in the sharing, but I can reinitiate and see.
Let me get up a moment, and I'll try and pull it down if you like, Todd.
That'd be great.
So I'm just going to go ahead and share what's on the next slide, and then the next one is interactive. So while Catherine works on pulling that up so we can advance that, I'm just going to share a little bit about what we mean when we talk about engagement. So when we think about engagement in our research processes, we want to make sure that everyone who is impacted or affected by an issue that impacts themselves or their family or their community has a say in defining both what that issue is and deciding what to do about it. So working with us to come up with solutions. And working with and listening to community members, families, to develop those meaningful solutions to complex issues is something that we're also called on to do when we're working in an engaged way. We really want to think about being inclusive, connected, and in relationship with the communities that we work with. So I invite folks to open up the chat and share in there, why does engagement matter? So please use the chat to share your ideas. Why is engagement important with the communities that we're working with in our research and evaluation work? Yeah, great. Great ideas, everyone. Thank you. Facilitates implementation. It's a key for respect. Understanding stakeholders' needs to ensure our work is relevant and applicable, useful for those that we serve, to learn what the critical issues are. Those closest to the issues tend to be those closest to the solutions as well. Yes, great. Bring in perspectives and build an embedded understanding, develop trust between communities and researchers to get buy-in. Great, all great ideas, thank you. So Catherine, can you flip to the next slide? So does engagement always equal equity? And we know, of course, it definitely doesn't. We know that as we go into communities, we take the time to hear, but we're not necessarily always listening to what folks have to say. We also then have a tendency to ignore and do what we think is best for a community anyway. Other things that can happen too is that those ideas are heard, but then they're not credited back to the community members who shared them. So ideas and ownership are taken. All of these things can foster disrespect and create harm within those communities. We also need to really think carefully about the power dynamics and imbalances. They're often not named or addressed when we are going to engage with the communities that we're working with. And people with power and the information that comes with it often work to keep it, often without us knowing that that's what we're doing. So gatekeeping and information hoarding are big signs that we are not authentically engaging and that we're working to maintain systems of oppression in those communities that we're working with. Another reason it may not be advancing equity is that the people who represent the populations and the community aren't actually represented in our teams and our community groups. So thinking carefully through that is very important. And then I wonder what else, using the chat again, where else you see attempts at engagement perpetuating inequity. So again, just inviting folks to drop into the chat where else they might be seeing this. Yeah, great. Yeah. Yep. Yep. Yeah, so gatekeeping happens in the jargon that we use too. Asking questions that matter to us, but aren't the right questions based on what the communities need. Taking people's time and either not reporting their ideas or reporting them as the researcher's own. Yeah. Yeah, yeah. We definitely don't think enough about the time affluence that we have that others don't have and how we can better manage that. Yeah. Great, thank you all for those. Next slide, please. Great. So then how can we build more equity through engagement in our work? So one of the first things we can do is look at our teams. So what diverse perspectives do you have and which ones do you lack? And remembering that homogeneous environments foster homogeneous attitudes and practices. So as we don't think about how to diversify and be inclusive even in our teams, that is reflected in the practices with the communities that we engage with. We also want to make sure that people with minoritized identities in our group setting are getting equal time and voice and making sure that they are being heard. Making sure that our work and our team work to create an inclusive space when we're engaging with communities. Another idea is to examine our accounting structures. Are they respectful to community partners and study participants? One area this creeps up is, do we require community partners or participants to front funds, and why? Do we make spaces inclusive? Do we provide what folks need to be able to be there and participate? Again, we want to be questioning everything that we know, ways that we are complicit in perpetuating racism and maintaining these systems of oppression. One of the other things to think about too is embracing mixed methods. So we want to think about sharing stories and whose stories we tell and how we highlight those stories. And then of course, budgeting accordingly. So how are we returning resources to the communities that we work with? Next slide, please. So at the Jordan Institute for Families, we've made a commitment to advance racial equity, and these are some of our commitments here. So we really want to work to build our skills to speak truth to those who maintain unjust systems, calling out what we see when we see it in the moment. We'll also work to use our endowment funds to build a more diverse team to inform and lead our work. We'll listen to community leaders working in family well-being about the role we can play and how we can serve their needs. We will work to prioritize projects that center racial equity and approaches that fully engage the people of focus. And we're deeply committed to the ongoing and hard work of becoming an anti-racist team and institute. And again, there's more I can share, and I'm happy to do that offline later. And thank you so much.
Thank you. I really appreciate that, Allison. So for the next part, we're going to walk through a couple of different strategies that we have used in our work. So next slide, please. And I'm going to take the first one and talk about one of my, I think, most favorite ever projects, which was funded by the Patient-Centered Outcomes Research Institute through an engagement award. And so I'm talking to you a little bit about how to bring patients and clinicians and others together to build community and research agendas. So this is a picture of our team from our 4th trimester project. And our goal was to create patient-centered research priorities for the months after birth and actually design what those studies would look like. And I want to highlight the purple shirts in this slide. Something that we learned through our project is really the dress code matters. And so the moms really wanted matching t-shirts. And so everybody wore the same shirt. And it really was so important in creating a sense of a equal playing field in our work. And so I wanted to point that out. Next slide, please. So with this project, I think something that's really important to think about, especially as you're starting to build a research portfolio, is that planning grants can be incredibly valuable. And so this was essentially a 2-year planning grant where we were able to engage with a cohort of mothers that all had really little babies. They were all about 4 to 6 weeks when we started the project. And we had an in-person meeting where we brought those new moms together with community partners and clinicians and researchers. And we did used monthly discussion topics by webinar that the women selected and had conversations. We had a private Facebook group where we were able to continue conversations where moms started sharing information with each other. We did a few in-person sessions, and we held those at a local children's museum, and were able to provide tickets for the museum for the partners or friends and children so that they were very happy and occupied while we had a few hours with the moms. The moms also, we spent time with them talking about what research was and what research designs and different options were available to them. And so that was basically what we did. Lots of time and lots of different formats to just spend time really digging into topics around postpartum health and well-being. Next slide. So a few tips that I wanted to share that we learned. I already mentioned, think about what to wear. People care and want to know. Think about name tags. So we just did first and last name, very simple. That's all we had on those tags as a way of creating a sense of equity. We spent time preparing our consumers or patients for every meeting that they were going to be part of so that they felt comfortable and knew what to expect. We thought very carefully about their needs and we asked about their needs. So we had refrigerators for breast milks and breastfeeding rooms and cribs and play corners and you name it, we had it so that they were able to fully engage and participate. We pay people very well for their time, and that's part of the budget accordingly. We wanted to be very respectful of their time commitment and understanding what it meant for someone with a new baby to engage with us. We asked permission for every single photo and all recordings, and didn't show any picture without complete permission from everyone in the picture. We have made careful to really center the ownerships of the results and findings. Something else we learned is not everyone has a credit card. So you could offer to pay for a hotel or something for someone. If they don't have a credit card, then they can't check into the hotel. And that can be really embarrassing until you sort it out. So some small things like that we've learned. And if you have children, which everyone should have meetings that are full of children. It was so much fun, but you need to be ready and cool with a little bit of chaos and bring snacks. So my special epic moment was I was holding a baby while a mom was presenting, and that sweet baby threw up massively all over me in front of the room. But it's also great because you have a group of like 50 moms and they had you cleaned up right like that. So next slide. I will say that and the results of this work were exciting. So we ended up with 3 fully designed research studies designed by moms, for moms. We published multiple articles. We've given interviews in the Wall Street Journal, all different kinds of media. Our personal social media grew to 20,000. That kind of grew from that Facebook page. These moms have stayed engaged with us and consulted with us as we've designed other projects. We've been able to build a pipeline of resources, and we launched a website, newmomhealth.com, from that work. So a great $200,000 investment, a lot of energy and heart, and definitely the most fun I've ever had at work. So I'm going to turn it over to Catherine.
Thank you, Sarah. I'm going to talk a little bit about human-centered design and our work on an early childhood education data user project. So this project started with a survey that we did statewide of early childhood education data users to have a better understanding of the types of data that were available and how they were used. From that survey, we pulled together recommendations and findings, and one of those recommendations was that data systems and services should be designed to be human-centered. As a follow to that, we decided to do 9 data design roundtables across North Carolina with a variety of stakeholder groups. And we used the human-centered design framework to inform our process for engaging in these roundtable discussions. So just to give a bit of context for anyone who's not familiar, human-centered design is a multi-phase process that begins by engaging with the group that a solution is being designed for and results in a solution that meets the need of this population. This particular definition comes from IDEO.org and is available at the link that you see below. And they have some wonderful resources about human-centered design. As you can see on the slide, we also have marshmallows pictured here. So one of the things that we did in order to get our participants more comfortable with the idea of using this type of design thinking and working together is we had our small teams that were working with each other at the data design roundtables work to build the tallest tower in the room out of spaghetti and marshmallows. So this was a fun and interactive process for everybody to kind of get used to and have the process for design thinking down, and have this kind of fun icebreaker type challenge to work with one another and get to know one another better. Can also use pipe cleaners or all sorts of other different types of warm-ups, but that's just one we wanted to share with you all. So human-centered design has these 3 larger phases, so understanding, ideation, and then experimentation and implementation. And as you can see here, there's opportunity in each to really learn more, work together to develop your ideas, refine what your question is, and then design together some sort of prototype and then test that. And I like to really focus on the fact that this is an iterative process. And as you can see here, you may get to something that you're experimenting with and go all the way back to understanding, or you may go to ideation, and that this can keep going forward. So in order to work with our partners on this project at these data user roundtable sessions, we pulled together a few different tools, which we'd be more than happy to share. Please reach out and let us know if you would like copies of them. Where first we had folks describe how they use data themselves and what their experience has been with this early childhood data, and then how they would like to see this data improved. And then, as I mentioned, we had folks working together in small teams at each of these data roundtables. And these individuals then all talked together to share about their personal experiences, and then wanted to have them identify one improvement that they would all like to collectively design for and share their insights about, and define their how might we question, which is part of the human-centered design process. From there, we had individuals go back to working on their own and design a solution, and then come back together as a small group and develop a final design that was informed by one another's work. We had everybody share their work with one another. We had people draw on flip charts and be able to walk through what they had come up for as design. And teams also completed a environmental policy analysis to assess the level of the solution, where this would need to take place, whether or not a policy change would be needed in order for this proposed solution to be realized. Identify who could be potential champions of this, and how feasible it was. So, and with that, I'm going to turn it over to Paul.
Thanks, Catherine. My name is Paul Lanier. I'm associate professor in the School of Social Work and associate director for Child and Family Wellbeing at the Jordan Institute. And I'm going to talk some about data visualizations and engagement around systems thinking. And so, I'm sure many are thinking, you social workers, you're doing arts and crafts and playing with babies, and that's kind of fun. But what about these rigorous methods? So these are important too, especially in systems science work. And so I'm going to talk about an example from a home visiting landscape analysis we did here in North Carolina. And so thinking about the word systems, and that's kind of in the background, we're talking about things like systemic racism and inequities in systems. We need to be able to visualize and understand and kind of interrogate what that system looks like. So home visiting as one complex system, we had a research project where we were trying to understand the home visiting system in order to figure out kind of where to engage and where to transform that system to be more a part of promoting equity in maternal and child health. So I'll show an example real quick. We're going to get to this use of a data walk as one way to have a conversation about data. Next slide. So in terms of some other, kind of methods, we used social network analysis in GIS in this example, but just want to mention there's some other great methodologies that could be used when you're, again, examining and trying to describe a system. That would also be really good, I would say, for engaging around questions of equity. Next slide. So the first thing we did was there was a lot of confusion and lack of understanding about who all the players were in the policy space. A lot of people interested in home visiting as a potential policy and practice solution, but there was a lot of fragmentation, a lack of coordination of who was doing what. So we tried to, again, inventory, all of the different groups in North Carolina who are working on these and look at the points of overlap of individual people that were sitting on these different committees. And long story short here, we have, what could be described as a pretty dispersed network, not a lot of connections. You only have a handful of people that are sitting on multiple groups, and a lot of people just kind of seeing one group at a time. And we're also able to kind of look at who these individual people are and how representative they are of the community. So this is an example of kind of an organizational social network. Next slide. Then at the local level, we collected data on referrals and collaboration between organizations. So we have 2 counties here represented. So then at the county level, we can say, well, what does your home visiting and kind of early childhood systems look like? On the left, we have 3 home visiting programs. You see one on the far left, home visiting program 1 is kind of disconnected except for this one school readiness program. You've got one program, home visiting program 2, kind of in the middle that acts as a hub. And then you have this group of 4 programs with home visiting program 3 that are off on their own. In contrast, in County 2, you see this more integrated set of services and programs. Still 3 home visiting programs, all kind of centered around our local Smart Start, our local partnership for children in that county. And again, just being able to look at, when people know like these counties, it kind of helps them, again, visualize and put some language around maybe some things they feel are going on in a county, but aren't able to kind of visually describe. Next slide, please. Last GIS, so again, for North Carolina, we wanted to know where kids were and moms and families were relative to where services are. So we first looked at kind of where the population, and this is just one example. We looked at overall 0 to 3 population. Next slide. That's where kids are in North Carolina. And then we collected data on where services were offered in North Carolina, which tended to be around our kind of larger urban areas. So one GIS method that we found to be pretty useful is you want to put these 2 pieces of information together, services as well as populations of interest. Next slide. And this is a bivariate map, which we won't spend a whole lot of time on, but you can use these different color features of the map to show where do you have lots of kids and lots of services, or where do you have lots of kids but not a lot of services. And so then breaking this down by things like race, ethnicity, urban, rural, et cetera, we had a more kind of nuanced description of where the service gaps were in the state. This is a scarce resource of home visiting. And then for planning purposes, if we're wanting to invest in home visiting, where will be some strategic places to think about where our investments would do the most in terms of promoting equity, for example. Next slide. So those 3 visuals there, the social network graphs of organizations, the county level graphs of the agency networks, and the GIS maps, we brought to a statewide home visiting summit. And we did something called a data walk, which we stole from NEKC Foundation. I believe the top citations from Urban Institute. And this seemed like a really cool thing to try to engage our audience. So we knew we weren't going to have a room of accountants and statisticians. So showing slides with numbers didn't seem like a great kind of engaging way to have our audience think about these data. So we set up basically an art gallery, printed out these visuals on 2, 3, 4 foot pieces of cardboard paper, kind of like you'd have at a professional scientific conference, and had groups of 10 people kind of walk through in phases with the facilitator with them. And again, we set it up kind of again like an art gallery where data is up for interpretation, and we need to have a discussion about what the meaning of the data is, and what you see could be different from other people. We found this was a really nice way to again, kind of democratize the data, make it more engaging for folks, and spark conversations about what does this mean necessarily for our state. And next slide. I think that's it for me.
All right, I'll take the baton here. My name is Todd Jensen. I'm a research assistant professor in the School of Social Work and a family research and engagement specialist in the Jordan Institute for Families. It's great to be with you all. So here we're kind of going to shift our focus somewhat in thinking about how can we effectively convene and engage stakeholders, particularly in the context of relatively complex, multi-system, community-based interventions or initiatives, this kind of place-based work that can often feel nebulous and complicated and yield unforeseen consequences as we're all trying to kind of implement this initiative as a kind of collective community. And there's a lot of work in research methods that have been developed, particularly by Michael Quinn Patton, in this kind of larger area of what we call a developmental evaluation. And a tool within that larger toolbox is more specifically referred to as a principles-focused evaluation. And this involves a process of convening stakeholders to co-create a set of guiding principles that becomes a focus of evaluation. And we can think of principles as being actionable statements that inform and guide decisions and choices. And we know in these complex multi-system interventions or initiatives, there are many moments of decision-making, choice-making. Then we can together evaluate whether these emerging principles are sufficiently clear, meaningful, or actionable. And after establishing that, we can go on to continually assess whether the principles are being followed or implemented or applied in these decision-making processes, and ultimately go on to continue to assess whether or not the application of these principles are yielding their intended impacts. And we can think about drawing from lots of different resources as a group of stakeholders, right? Experiences folks bring to the table, their expertise, a kind of higher order set of values that various organizations might have, and the research. There might be literature we can draw from. Next slide, please, Catherine. Thank you very much. So turning to this brief case example, so here we're zooming in on the Get Ready Guilford initiative. So this is a large community-based initiative intended to improve outcomes for children and prepare them for school in one particular county in North Carolina. So the team I'm on at UNC early on in this work led this developmental evaluation effort. We're now currently taking on more of an implementation support role. But looking into that earlier developmental evaluation period, we provided support in convening stakeholders of this initiative, facilitating a process whereby they co-created a set of core values or beliefs about the work they were engaged in. And so here's an example of one of those values. So we believe that the Get Ready Guilford initiative should be family-led. And then drawing from values such as this, we can co-create more actionable statements we call principles. And so here's an example. Families serve as decision makers, partners, and change agents. So now stakeholders, and this again, just taking one example, there are several values and principles that these stakeholders developed. But now we as evaluators or researchers can support efforts that stakeholders take to evaluate the quality of those principles and making refinements as needed, and then assess whether that principle is being applied over time, and assess whether those principles appear to be making demonstrable gains or impacts in that initiative work. And so essentially these principles become these North Stars that we can orient ourselves to when we're faced with making decisions and stepping into uncharted territory, which we often do in these very complex intervention contexts. Next slide, please. And so just to finish off this piece, just a few quick tips that I think were proved to be helpful, at least for our team. So we definitely want to think about being inclusive in the convening of stakeholders, right? We're entering into a space often as outsiders. Sometimes we're embedded within the very communities in which we're working. But we want to draw upon diverse perspectives. We want to empower stakeholders to be engaged in this process. And ultimately, we want to facilitate these convenings with the intention of promoting stakeholder ownership, right? These are their values. These are their principles that's going to guide their work in their community. And related to that, cultivating champions has been shown to be effective. And we actually have in some of our meetings, these local stakeholders leading these efforts to assess whether principles are being applied. We even have those values and principles embedded in the meeting agendas for a lot of the working groups for this particular initiative, and champions actually lead out a lot of the discussions around those principles and how they're being applied and making a difference. As facilitators, it was helpful for us to provide just very basic guidance in laying out kind of key concepts, right? Defining what, or explaining what we mean when we say value versus principle and so on. And then also encouraging simplicity, right? So we don't want to necessarily have a unwieldy number of values and principles that we're having to crosswalk all of our decision-making with. Instead, we might want to have a arguably more manageable set of values and principles that we can really dig into as a community. And we certainly don't want to rush this process and allow this to really unfold. And that might mean multiple convenings with these stakeholders to develop these principles. But I think that is it for my section.
Thanks, Todd. Yeah, I think it's we've been reading a lot of work from Adrienne Marie Brown. She has a book called Emergent Strategies, and in that book she talks about moving with the speed of trust. And I know that can be really challenging when we work in very competitive and time crunched academic spaces, but I think it's something that until we can learn how to move with the speed of trust, we're not going to be able to fully engage. And I think that's really what the Get Ready Guilford work that Todd described is really trying to do. So I get a third shot to remember to introduce myself to all of you. I'm Sarah Verbees, and I direct the Jordan Institute for Families at the School of Social Work. And I'm also the executive director for the Collaborative for Maternal and Infant Health in the School of Medicine. And I'm going to close this out really quickly with talking about engaging in a virtual space, some of which we are all doing now, and we've all had more experience doing than we ever dreamed or wanted. Next slide. But I want to highlight a couple of things that we've used that have gone well as we close out. So the first project I'm going to talk about very briefly, we received some of the CARES Act funding. We received $4 million that to be spent in a very short amount of time to address maternal telehealth access. And so we had a number of charges. And before we even started doing the work on the charges that were given to us by the federal government, next slide, we added more work, but we added a whole assessment phase to that work. Our funders were happy for us to do that work as long as we did everything else. And we just felt that we couldn't define what the needs were or what messages should be or what needed to be done until we did some rapid listening. And so with our approach, we had started with some of using mixed methods, everything from an environmental scan to all different kinds of literature to listening to stories, and in a number of ways, which I'll talk about. We then did an assessment of providers and did some community assessment. And from that work, that became the foundation for the rest of our project. We were able to accomplish this in a quick way because when we received the funding, we intentionally reached out to the people that we knew were best to do the work. And so we did a lot of subcontracts with a lot of absolutely amazing organizations that are led by women of color, and created a collaborative leadership model for this work. Next slide, please. And so just as a glimpse, a couple of interesting methods that we did is, so one thing that we noticed is that there were a lot of organizations that were collecting stories about birthing and becoming mothers during the pandemic. And several of our partners had good relationships with these different groups. And we were able to reach out to those different organizations, and they shared all of their stories with us that related to telehealth. We also had groups that partnered with us, Reaching Our Sisters Everywhere and the National Birth Equity Collaborative, who had deep ties with organizations across the country that are providing doula services and support services, and are really the community groups that we want to hear from. And they received funds and they did the listening, and were able to get groups pulled together incredibly quickly. So we did a tremendous amount of work in the space of about 6 weeks. And so it can be done. And really what I learned, it's all about the partners that you're engaging, the people that are out there that know how to actually listen to the community. We just need to pay them and get out of the way for them to do that. Next slide. And so along the stories theme, the survey is now closed, but we had about 2 months of funding, and we worked with partners at the UNC School of Information Science. And they had really cool website that they built and methodology that allowed us to do digital story collecting and listening. And so the platform worked, it was also in English and Spanish. So people who got the link, they could either type their story or they could just push a button and record their story or their experience and click send. They also had the opportunity for every state. They had 3 different prompts that they could respond to. For each one, they were able to say, you can only you can look at this. You can share this with other participants. You can take my name off and share it on a website. You can share this with legislators. So we gave them full control over how each of their stories was going to be used. We ended up with 220 stories, again, that we collected in a really short amount of time to inform OB practice in North Carolina. And just the results and the stories are incredibly rich. Next slide. So again, thinking about these different types of data are ways that you can help think differently about engagement. And then finally, this one, we're going to give credit to Neil Helfand in this one. I met Giselle Chow, who was our visual facilitator at one of Neil's meetings in LA, and fell in love with her and the method. And we found ourselves, and this is a slide about what is visual facilitation. And this is a different method that it's just really cool. It's someone who can kind of record as people are talking, and it helps kind of get out of a linear way of thinking of just words on a page, which is white supremacist culture, and pulls us into thinking about images and connections and how different things connect with each other. Next slide, please. And so we found ourselves needing to do, and this is, I'm going to move forward. This describes a little bit more about graphic facilitation, but in the interest of time. So for our project, we had participants from 4 different states. We were trying to do some wrap up and really listen to what they learned in their project. We had utter fails with other formats with this group. It was crickets, nobody spoke. And so we partnered with Giselle. We were her first group that figured out how to do this online graphic facilitation. And the results were absolutely amazing. Next slide. We had partners that were always quiet, that stayed on beyond the time of the meeting, that were fully engaged. And the kind of information that we pulled out from those different groups was amazing. And we heard back from our participants that they loved the drawing. They found it soothing, relaxing, that it really sparked different ideas for them. And so using this transformed a virtual space into a space that was much more collaborative. And also graphic facilitation as a method is excellent, and would encourage you to think about how you might use that in different meetings in different of your spaces. So a final thought about virtual, doing some research, next slide, in the virtual space, is that this is where, if you've invested in having partners with community ties, it's going to be wonderful. It's always going to be wonderful. It's going to be especially great in a virtual space. Several of us have a project funded by Robert Wood Johnson that's, we're in 5 different rural communities. We were supposed to do 20 focus groups, all virtual. And you know what? We have the best community partners. We have upwards of like 40 people signing up for these virtual focus groups, and they're going really well, but it's all because of the community trust and who we're partnering with. So just always build genuine partnerships with people that you have common interest with, and it will be to your benefit. We found that it's really important in these spaces that people have time to greet each other and connect and say hello. There's lots of tools in Zoom that I'm guessing by now many of you have used, but we've used pretty much all of them. And that with community folks that struggle with technology, you need to have a tech facilitator who can kind of both mute when necessary and really be there to help them, and also keep it short. So this brings us just to the last slide. And if others want to come on camera for our last few minutes so that we can have questions or other conversation. So just as we kind of end this quick tour through methods and strategies, some key points is that engagement takes time, but it is a time investment that will pay off in so many ways. that engagement work needs to be paired with self-work, teamwork, and institutional equity work. And thank you for the question that was in Q&A. I think all of these methods have the opportunity to both be create equity or to continue to perpetuate disparity. And it's really about how those tools are used. And that means that for those of us who identify as white in particular, that's a lot of ongoing work to see that privilege and see what we do and hold each other accountable, hold our team accountable, and our institutions. We need to have this work well-resourced. We need to pay people fairly for their time. And also, I suspect there's a lot of type A's out there. I feel like a lot of us in the academy are type A's, but we've learned, don't let perfect be the enemy of trying. Just if you're not sure something works and you feel like you haven't researched it enough, do the best you can, go into it with a full heart, and go to learn from each of these different methods that you use. Creativity and flexibility are really important. And also, and I think this is the best part, that you're going to learn a lot and meet new people and love your job. And I just have to say that the more and more that we're able to really build these genuine partnerships, every day is interesting. There's so much to learn. Relationships grow, and it's definitely worth it. So with that, we welcome you to put anything in the chat, and also wondered if Allison or others had anything they wanted to respond to any of the chats or the Q&A.
Sarah, this is Catherine. I'll just tee that up if you don't mind. So again, we wanted to highlight for those of you who haven't looked at the Q&A, we want to appreciate the question around the challenges around the HCD requirements for some community folks to engage in, and also the strong critiques of HCD in supporting white supremacy. So we've responded to that one in the Q&A, and then also the comment that we would like to see more BIPOC researchers represented in this engagement webinar when so much good work is being done by them, and we concur with you, and our team is committed to diversifying. We are going to answer one live, so I'll just read this one out loud for folks who haven't seen the Q&A or maybe you're elsewhere. Thank you for this great webinar. I'm learning a lot. How do you incorporate the community in the outcomes of the work? For example, in giving presentations like this, is there representation, inclusion, diversity here as co-authors on papers, etc.?
And I might just start there. That's a great question. I just wanted to share one recent example. We just had a paper accepted to open call talking about dismantling racism in social work. And our paper traced the work at our school to become more of an anti-racist organization, really highlighting the deep efforts and long-term work of our students. So in that case, our students were our community that we were engaging with. And so they are both co-authors on our paper. They are presenters, co-presenters at conferences, and we're now working on other ways to highlight their work for that paper. I'm looking at some ways, alternative methods for getting those results out, and looking at podcasts and Twitter threads and ways that we'll do that once the paper is officially out. And I'll see if any of my colleagues have ideas too.
Sure. Well, I want to also lift up, we absolutely looked at ourselves in this webinar, and we're very aware of our identity. I think where we've been able to do work currently, like I said, is as we're getting resources, getting those out to other folks, and again, really think about those genuine partnerships with communities as the first place for us to start. And then, like I said, we do have a commitment to using resources to really diversify our UNC team. And I think when it comes to sharing results, again, we couldn't present each of these different projects. We just are giving you a snapshot. For the ones that we have done, we have definitely been intentional as we're thinking about publication. We've done a lot with social media, like Allison said, and just thought of different ways that we can have different people's voices represented in spaces where they are. And we've also stepped aside and gotten out of the way for media opportunities, speaking opportunities. And so what I think I'm learning is it's a lot about getting out of the way.
Thanks, Sarah. I'm just going to invite the other panelists, if you have any other comments, to add that into the chat for everyone to see. We've had a couple of other questions come in. So first is, what are the best ways to engage physicians as participants? Anybody has thoughts on that?
Be mindful of their schedules. I mean, I think it's like anyone, ask what is a good time that works for them. I found that if you can get on times when there are regularly scheduled meetings that are happening, that has been a way that we've been able to do focus groups effectively. We've also found that our physicians that have participated in our PCORI projects have really enjoyed it. And have really actually enjoyed being in a space where they don't have to be the physician, but they can just be in community with their patients.
Thank you, Sarah. Our other question that's in the chat is, can you speak to any challenges and or recommendations around navigating the IRB approval process for these types of community-based projects or projects that engage community members as key partners in the research?
Anyone on the team? You've
I
definitely.
might just add, I'm sorry, Sarah, I might just add one brief thing that some ways that we have done this at UNC is, everyone's required to do these city trainings around research ethics. And so we've been able to develop ones that are less jargon filled, and do that with our community partners so that we're in compliance with that IRB requirement, but also doing something that's more accessible and inclusive for our community partners.
Yes.
Thank you, Allison. Another question that's come in, any advice or tips for obtaining funding to start these projects?
Well, I think first of all, before you start looking for funding, starting to look for people that you would want to work with so that you're kind of starting together at the beginning. So that when you're applying for funding, you've already got a partnership started, so that you're really kind of walking the walk right from the beginning. And I think when you already have these really good partnerships, then it becomes much easier to write the grants because you've got a whole wealth of really great ideas that you're starting with. So for me, that would be the best suggestion. And then I think keeping your eye out for planning grants. And it might mean that you might do smaller grants, like the PCORI grant we just received is $100,000. And it's almost all of that's going to support patient stakeholders or other stakeholders. But it's an investment that we see in our work together. So you may need to really get smaller grants to be able to fund kind of the people's time and then build from there. The other thing in terms of the community-based projects is that we've also just decided that we're going to let go of publishing some things and actually just saying, here's the scope of work to the community group, you do that, and we just get the aggregated results that's going to inform our actual project. We've done that several times. I'm not tenure track. So there's that, but we've just decided it's much easier and it shows our full trust for them in their learning.
I think we're at the end of our time, so I'm just sort of jumping in here to say thank you very, very much. This was really a great overview of your work and really illustrative. My one comment that I make about engaging physicians and others is that what we're learning is that lots of interventions that are designed by academics all over the world might be shown to work in a limited way, but most of them then sit on a shelf after they're done because they were never designed with the community and with the people and in a way that allows them to spread and scale. So there's a really, sort of bottom line practical approach that if you don't do this kind of work in the kind of way that you've laid out as a sort of pathway forward, you might be successful with your project, but it probably ain't going to go anywhere in the long term because of how you haven't really planted it in a way that allowed it to sort of flourish. So I think there's real practical reasons for doing this as well. But thank you very, very much. And I want to thank everybody that joined us today. And we'll have this video posted on our website so that others can be directed to it and benefit from it. But thank you very much, the Jordan team.